Tumor is out, brainstem intact. Close him up.
I pulled you out of that neighborhood when you were 17. You had nothing. No money, no connections. Just those hands and that fire in your eyes.
I've trained 37 surgeons in my career, Elias. You are the finest thing I have ever made.
You didn't make me, Professor. You just wouldn't let me quit.
Same thing.
But to the hand of God.
It's growing fast. If it ruptures, he's dead in minutes. But the location, it's wrapped around the basial artery. The surgical risk is... I'll do it.
Elias, the patient is Professor Grant, your mentor. Hospital ethics might recommend...
I know exactly who he is. That's why I'm not letting anyone else hold the knife. If anyone in this hospital can get him through this, it's me. You know that. The other surgeons exchange glances, but say nothing. No one argues. Because he's right.
I'm going to get you through this, old man, I promise.
Scalpel. I can see the neck of the aneurysm. Preparing the clip.
His pressure's dropping 60 and falling. Heart rate's crashing. Push epinephrine now. What's happening with his pressure? I don't know. The dosages were standard. I followed the protocol exactly. Get his pressure back up now. He's in acidosa. No, start compressions, get me... Dr. Vance, his brain, the hemorrhage is massive. There's nothing...
The anesthesiology team has confirmed that all dosages were administered according to the written protocol. The protocol sheet has been reviewed and shows no irregularities.
Something was wrong with the anesthetic response. The crash was too sudden, too severe. That kind of hemodynamic collapse doesn't happen with standard dosing. I'm telling you, someone altered the protocol.
We are not a criminal investigation unit. We are here to determine whether proper medical standards were followed during a procedure that resulted in a patient fall. Your patient, your mentor. However, a new piece of evidence has been submitted to this committee, anonymously.
That whiskey isn't mine. I've never seen that bottle before. Someone put it there.
I apologize for the interruption. I was informed the committee might want to hear my testimony regarding Dr. Vance. It gives me no pleasure to say this. Elias was a gifted surgeon. But over the past several months, I've noticed patterns of behavior that concern me. Late arrivals, tremors in his hands during morning rounds, and the smell of alcohol, more than once. I approached him privately about it twice. He denied everything. I should have reported it sooner. That failure is something I will carry for the rest of my career.
Dr. Vance, based on the evidence before this committee, it is the determination of this panel that you operated under the influence of alcohol. Your surgical privileges are revoked, effective immediately. The committee also recommends that your medical license be revoked.
You're making a mistake. He's lying.
This hearing is concluded.
I understand.
Nathan Gray, Chief of Surgery, St. Martin's Hospital. 41 published papers. National media profile. Beloved by the board. 6 patients dead. All in his department. All within 18 months. They were all Nathan's patients. Something is happening inside that hospital. Something worse than what he did to Grant. But I can't prove it from out here. I need to get inside. Dear Mr. Miller, we are pleased to offer you the position of Night Custodial Associate at St. Martin's Medical Center. Please report for orientation tomorrow evening at 8 p.m.
I'm coming for you.
Gray pushed the Henderson case to Friday. He wants to do it himself. Said it's high profile. Meanwhile, I've got a resident who could do it with one hand tied behind her back.
Since when does he actually do his own surgeries? Every Gray procedure I've seen in the past year, it's Carter or Malik doing the real work while he supervises from the gallery.
Supervises? You mean checks his phone?
No, I don't care. It's not my fault.
A janitor is the most invisible person in any building. Nobody looks at you. Nobody remembers you. You are furniture. You are wallpaper. Perfect. HX 741, not in any formulary I know. What are you giving these people, Nathan?
Cleaning in here at this hour?
Got behind on my rounds. Figured I'd catch up.
That's a lot of dedication or floor. That's gonna be dirty again by morning.
That's the job, ma'am.
It's not approved. It's not even in the system, which means it's either experimental or it doesn't officially exist. 4 patients, 4 post-op records, same unregistered drug, all in Nathan's department. This isn't out malpractice. This is something else.
I'm here, Professor. I'm close.
Grant H. My dear Elias, there is something I need to tell you. I have become aware of certain irregularities in Nathan Gray's practice.
patterns I cannot explain through normal medical variation.
I'm telling you this because Nathan may be a danger to patients. Focus on the task at hand. Do what you do best. I am, as always, proud of you. Harold.
You knew. You already knew. And he'd defeat you for it.
I'll finish what you started.
Dis yellow, mass casualty incoming. Multi-vehicle collision on Interstate 40. Minimum 15 casualties. All available emergency personnel report to the ER immediately. Repeat, all available personnel to the ER.
Male, 40s, open femur bruisage, BP 90 over 60.
Female 20s, penetrating chest trauma, left helminthorax. Episodic bore, Corey's thorax, neck speech rounds.
Abdomen is rigid, distended, he's got free fluid. I think his spleen is ruptured. He needs surgery now.
OR is full. All attendants are engaged. Dr. Walsh is managing 3 critical patients in Bay 1. There is no one else, Dr. Cole. You're what he's got.
Somebody help me! I have a child dying in here! Someone! Anyone! Please! I'm sorry. I don't know how to save you. What? You can't be in here. This is...
What's his pressure?
65 over 40. Falling.
Pulse?
170. He's in hemorrhagic shock.
He has a grade 4 selenic laceration with active arterial bleeding. If you don't open him in the next 90 seconds, he's gone. I was a combat medic. Army. 3 tours. I've done this before. Let me help you. Give me the scalpel.
How do you... Who are you?
Retractors. Hold here and here. Keep the field open.
Clamp.
I'm gonna do a partial splanectomy. I need 3 oviculus suture and 2 more units of packed red veils. Now.
He's stable. Pack the abdomen and get him to the ICU for monitoring. He's gonna be fine.
You. Stop. Who the hell are you?
I'm the janitor, Dr. Walsh. I just help where I can.
Mr. Miller, you are not a licensed medical professional. You understand the legal implications of this?
He saved that boy's life. I was the one who couldn't. I froze. If he hadn't stepped in, that child would be dead right now.
Ma'am, I served in the Army for 6 years. 2 combat deployments. I was trained as a field surgical technician, battlefield trauma, triage, procedures under fire.
The hospital will not pursue disciplinary action at this time. But Mr. Miller, this cannot be repeated. You are custodial staff. Are we clear?
Crystal clear, ma'am.
Combat medic. 6 years, 2 deployments.
That's right.
The way you isolated the splenic artery, that's not battlefield training. That's fellowship-level technique from a place like Johns Hopkins.
I appreciate the compliment, Dr. Walshin, but I'm just a janitor who used to be a soldier. Have a good day.
Surgical technique, Johns Hopkins.
Phase X, Helix Pharmaceuticals.
Patient selection by chief of surgery, that's Nathan.
He's choosing which patients get an experimental drug off the books, outside the record system. That's not a drug trial. That's a black operation using human subjects. And those subjects are real people who walked into this hospital trusting they'd be cared for.
What are you doing in here?
Trash pickup. This room's en route.
Okay.
Too close. That was too close. But now I know what Nathan is hiding. It's not just what he did 5 years ago. He's running an illegal drug trial right now, in this hospital, on patients who don't know they're guinea pigs, and people are dying because of it.
Mr. Petrov, can you hear me? I need the on-call neuro resident to ICU now.
Get me a stat CT. No, there's no time. Check his pupils. He's herniating. The hematoma is expanding. He needs an emergency burr hole right now or we lose him.
Neurosurg on call is Dr. Torres. He's in surgery. ETA at least 20 minutes.
He doesn't have 20 minutes. He has about 3.
Coacher's point, right side, 2 centimeters anterior to the cranial seption, 3 millimeters lateral to midline. Use a hand drill, 14 millimeter bit. Nick it with a scalpel and the energy will decompress on its own.
What did you just say?
I had some medical training a while back. The drill is in the emergency procedure kit behind you. 3rd shelf, red case. You can do this, doctor. I'll talk you through it. Mark the point. Good. Incision through the scalp. You want about 4 centimeters down to bone. Now the drill. Steady pressure, perpendicular to the skull. You'll feel resistance, then a sudden give when you breach the inner table. Don't advance past that point. You're almost through. 3, 2, there. Stop. You're through. Remove the drill.
My God, it's working. You did well, doctor. He's gonna make it.
Dr. Walsh, you won't believe what happened tonight. That janitor, the one from the ER last week, he was in here again. Kessler had a crashing post-op neuro patient, and the janitor talked him through an emergency burr hole, talked him through it like he was teaching a surgery class.
Kessler said the instructions were flawless. He said it was like having the chief of neurosurgery standing behind him. But it swears me of dismachanding one and not a combat medic.
Elias Vance. It is you.
Nathan testified against him. Nathan got his job after he fell. That's not just surgical training, that's neurosurgical training. Specifically, that's a technique set taught at exactly one institution, the same institution where both Elias Vance and Nathan Gray trained.
Catherine? It's almost midnight. This better be...
Margaret, I need to ask you about someone. A former colleague of yours at Hopkins, a neurosurgeon named Elias Vance.
Elias? Why are you asking about Elias?
Did you believe the charges against him? The drinking?
Catherine, what's going on?
Just answer the question. Did you believe it?
No, I never did. Elias Vance was the most disciplined surgeon I've ever worked with. But the evidence was there was nothing anyone could do. Why? Have you found something?
I might have found him.
Seven people walked into this hospital alive, put their lives in Nathan's hands. He gave them an experimental drug they never consented to. And when it defeated them, he wrote the deaths off as routine complications. 7 people murdered, and nobody noticed. I need the paper trail between Nathan and Helix Pharmaceuticals. Without it, he can claim ignorance. The real records are in Nathan's private files. His office, his computer.
Elias Vance. Johns Hopkins class of 2014, youngest chief neurosurgery resident in the hospital's history. The hand of God. License revoked 5 years ago for operating under the influence, resulting in the fall of your patient, Professor Harold Grant. Now you're mopping floors for the man who testified against you. So, are you going to tell me what's really going on, or am I going to figure it out myself?
How long have you known?
Since the night you saved that boy. I suspected from the moment I saw your hands. A surgeon's hands don't lie, no matter what name you put on the badge. I confirmed it 2 weeks ago. I called a contact at Hopkins. She remembered you. She said she never believed the charges.
Then why didn't you report me?
Because something didn't add up. You wouldn't be sneaking into the records archive at 2 in the morning. I want to know what.
5 years ago, I operated on Professor Grant. He had a cranial base aneurysm. I was the best surgeon in the department. The surgery was going perfectly. Then his vitals crashed, hemodynamic collapse. He died on my table. Nathan Gree altered the anesthesia protocol, changed the dosage enough to cause a catastrophic drop in energy pressure. It was designed to look like an anesthetic complication, unprovable. He murdered Grant, he framed me. He took my career, my reputation, my entire life. He's running an unauthorized drug trial. A pharmaceutical company called Helix is paying him. 7 patients are dead so far. Their deaths were disguised as complications. The drug HX7741 isn't in any database. Nathan isn't just a murderer, Catherine. He's running a factory.
3 months ago, I had 3 patients transferred to my department from Nathan's service, all post-op, all presenting with drug reactions I couldn't explain. I flagged it to Nathan. He said individual patient variants.
So you've seen it too, from the other side.
I need to verify this on my own. If any of this is fabricated or if this is some personal vendetta, I will personally hand you over to the police and the medical board. Do you understand?
I understand.
Stop saving people in the middle of the night. You're the worst undercover operative I've ever seen.
2 of us now, Professor. 2 of us now.
It's probably nothing. But you asked me to flag anything unusual with night TAF, so... The night janitor, Miller. Ethan Miller. He was in the conference room last week when I went to pick up a printout. Said he was collecting trash, but he was standing near the printer.
How near the printer? Pull the after-hours surveillance footage for the past month, every camera on the 2nd and 3rd floors, flag every instance of Miller appearing out of position, then you'd better get started. A janitor with a key card to the records archive, spending 45 minutes cleaning a room with no windows. Who are you, Ethan Miller? I want 2 additional cameras installed in the records archive. Covert, motion activated. I want to see every angle of that room. Route the feed directly to my personal workstation. Can I count on your discretion? I have the drug codes, I have the patient deaths, I have the Helix connection.
But without the financial records, the payments from Helix to Nathan, there's no proof. The money is the key. Gotcha.
Placenta percreta. She's been bleeding for 20 minutes. Fetal heart rate is dropping.
Don't go in. Every time you step forward, you risk everything. But that's 2 lives.
If I take the uterus now, we lose the baby.
Heart rate 75.
Damn it.
Dr. Kestner, don't take the uterus. There's a technique, modified chandelier stitch.
What are you? That technique is only in case series. Trust me. You can do this, step by step. Deliver the baby first, then do what he says.
Identify bilateral uterine arteries. Leisure them, use figure of 8. Good. Good.
Oh my God. It actually worked. Mother is stable.
Who the hell is Ethan Miller? So, someone is building a case against me, using my own files, from inside my own hospital. But who is Ethan Miller, and who is he building it for?
It's Gray. I need a full background check on an employee at St. Martin's Medical Center named Ethan Miller, custodial staff. I need it fast and I need it thorough. Everything. Social security trace, address history, digital footprint, facial recognition if you can manage it. Whatever Ethan Miller is, I want to know what's underneath. 48 hours.
Elias Vance, you survived, and you came back. You actually came back. That was a mistake.
Thank you all for attending on short notice. I've called this emergency session because we have a serious security breach that I believe poses an immediate threat to patient confidentiality and hospital integrity.
Please, sit down, Mr. Miller.
Three weeks ago, I became aware that an unauthorized individual was repeatedly accessing our records archive after hours. This individual is listed as Ethan Miller, but an independent background investigation has revealed that Ethan Miller does not exist. The man sitting in this room is Elias Vance, a former neurosurgeon whose license was revoked after he operated under the influence and defeat his patient. That patient was his own mentor, Professor Harold Grant. He infiltrated this hospital under a false identity. Whether this is espionage or a vendetta, I leave to the authorities. But I want this man removed from this building. Today. Now.
Mr. Vance, your employee badge and key card, please. Don't come back. You're flagged in the system. If you step foot on hospital property, we call the police.
You think you could dig something up? Every file you photographed? The originals are gone. Moved. Overwhelmed. You have nothing. N.
He didn't just catch me, he anticipated it. Every file I copied, the originals were the foundation. Without them, my photos are just digital images with no neckpiece of custody. Any lawyer would have them thrown out in minutes.
5 years. Months of planning. Every night in that archive. Every risk. Every moment I held my breath in that building. Gone. What do I have? What do I actually have? Photos that can be challenged as fabricated. A memo fragment from a shared printer. Medical records with no originals to verify them. The letter of a dead man who never got to finish his investigation. It's not enough. None of it is enough! You started this before I did. You saw it before anyone. And they defeat you for it. I've spent 5 years trying to finish what you started. And I failed. I'm sorry, Professor.
I pulled the data from Nathan's private server, his personal machine in his office. He was logged in when the board meeting happened. He was so busy overwhelmed that he left his door open. This contains the complete Helix Pharmaceuticals Phase X trial database, every patient, every drug batch, every dosage record, and Elias. $312,000 in wire transfers from Helix Pharmaceuticals to a shell company registered to Nathan David Gray. Bank routing numbers, dates, amounts, everything. I believe you. I verified the drug codes against my own patient's adverse reactions. They match perfectly. HX741 is an unapproved immunostarter compound that Helix has been trying to push through FDA trials for 3 years. They couldn't get approval through legitimate channels, so they found a surgeon willing to test it on unknowing patients for cash. Nathan Gray is a murderer, and now we have the proof. So tell me what we do next.
We stop hiding. We stop intense confrontation in the shadows. We make him face what he's done, where he can't run and he can't lie. I have an idea. Come inside.
The trial database is comprehensive. 147 patients enrolled in Phase X without consent, 43 experienced adverse reactions.
7 died. The rest are listed as ongoing monitor, meaning Nathan is still administering the drug.
The shell company is called Apex Medical Consulting, registered in Delaware. Single beneficial owner Nathan David Gray. 12 wire transfers from Helix over 26 months, total $312,000. This is airtight. But if we just hand this to the authorities, Nathan has time to lawyer up, overwhelm whatever server-side records are left, and spin a narrative. He's been doing this for 5 years. He knows how to control information.
So what do you suggest?
Nathan is giving the keynote address at the biggest neurosurgery conference in the country. 2,000 attendance, national broadcast, every major medical institution watching. I'm going to challenge him, publicly, on live television.
Challenge him how?
I'm going to publish an open letter as Elias Vance, the disgraced surgeon, questioning his surgical record, his patient outcomes, and his competence. And I'm going to post something that no one in the medical world has ever seen, a live, side-by-side surgical demonstration. Him and me, same procedure, same condition, judged by a panel of the best neurosurgeons in the country. And while the whole world is watching him fail on that stage, you submit the evidence to the FBI.
That's insane.
It's the only way. If we go through official channels quietly, he buries it. He has connections in the hospital board, the state medical board. He spent years building a shield. We need to blow the shield up in front of an audience of millions. And there's one more thing. Nathan hasn't operated in years. Not really. He delegates. He's from the gates. Haven't touched a patient in a long time. His hands, his skills have atrophied. He knows it. I know it. But the rest of the world doesn't. Not yet.
And if he refuses?
He can't. Not publicly. If a disgraced, licensed, reproved surgeon challenges the great Nathan Gray and he declines, the narrative writes itself. The media will eat him alive. He'll accept. His ego won't allow him to do anything else.
Then we need to move fast. I know someone at the Bureau, an agent in the healthcare fraud division. If I can get the evidence to them in advance, they can have a team in place at the conference.
Do it. My name is Elias Vance. 5 years ago, I was the youngest lead neurosurgeon at Johns Hopkins Hospital. I was called the Hand of God. Then in a single night, I lost everything. My career, my reputation, my freedom to practice the only thing I was ever good at. The man who testified against me, the man who built his career on my destruction is Dr. Nathan Gray. I do not ask you to believe me. I ask you to watch. At the 37th National Neurosurgical Association Conference in Chicago, I publicly challenged Dr. Nathan Gray to a live-by-side surgical demonstration. The same procedure, the same conditions, judged by a panel of the finest neurosurgeons in this country. The hands speak. Let the truth cut.
This is unprecedented. We've never seen anything like this in the history of American medicine.
The PR team is getting calls from every major network. AP, Rogers, CNN, NBC Medical. They all want a statement. The board chair has called 3 times.
I've read Dr. Vance's letter with a mixture of sadness and concern. Elias was once a talented surgeon, and what happened was a tragedy, one largely of his own making. But I will not run from a challenge. I believe in transparency. I believe in letting the work speak for itself. So I'm accepting Dr. Vance's proposal. I welcome the opportunity to demonstrate on the national stage the standard of excellence that this institution represents.
Sir, the conference organizers need to know the procedure selection. They're suggesting a cranial aneurysm.
I heard them. Set up practice time at the simulation lab every day this week. Book it under a different name. I don't want anyone knowing.
Come on.
You're still there. After everything. You're still there.
Everything's in place. Torres confirmed the FBI team is in Chicago. They'll be at the convention center tomorrow. Elias, are you okay?
I've been thinking about something Grant used to say. He said the most important moment in any surgery isn't the first cut or the last stitch. It's the moment you decide the patient is worth intense confrontation for. I know who I'm intense confrontation for.
Get some sleep. Tomorrow's going to be a long day.
Just here to let the work speak for itself. Ladies and gentlemen, colleagues, members of the press, welcome to what may be the most unusual event in the history of this conference. Today, 2 surgeons will perform the same procedure simultaneously under identical conditions observed by a panel of 5 distinguished neurosurgeons and a global audience. The procedure, endovascular-assisted serenial aneurysm cliving, one of the most technically demanding procedures in our discipline. The simulation models before you are state-of-the-age, featuring real-time hemorrhage simulation and sub-millimeter anatomical accuracy. Gentlemen, begin when you are ready.
La niña pequeña se pinchó deliberadamente el muslo con una rama para fingir que estaba teniendo su primera menstruación. Luego mostró a su madre la falda manchada de sangre, y la madre pensó que la hija realmente había empezado su periodo, así que se apresuró a llevarla a la habitación para ayudarla. Lo que no sabía era que la niña lo había hecho para distraerla una vez en la habitación. La niña, nerviosa, pidió rápidamente a su madre que revisara el álbum de fotos del teléfono. El teléfono estaba lleno de fotos familiares de varias casas, y la madre no entendía del todo el propósito de que su hija le mostrara esas fotos. Para sorpresa de la madre, la niña explicó que Jack, quien los había invitado de viaje, era un asesino y que las fotos correspondían a las familias asesinadas. La madre pensó que su hija debía haber quedado asustada porque de otro modo no sabría esas cosas. Así que la niña le contó que mientras jugaba a la pelota con el hijo de Jack, el niño había lanzado la pelota deliberadamente lejos para evitar la vista de los adultos. Luego la llevó a escondidas a una choza donde abrió un pasadizo secreto que conducía al sótano. Al entrar, la niña notó algo extraño. El lugar estaba lleno de artículos de uso diario y de teléfonos de distintos modelos. Mientras la niña estaba confundida, el niño abrió un álbum y le mostró más fotos. Eran fotos de diferentes miembros de distintas familias, pero de manera inquietante, cada una incluía a la familia de Jack. La niña seguía sin entender. Entonces el niño mostró una foto en la que aparecía él mismo y explicó que sus padres no eran Jack, lo que dejó a la niña incrédula. El niño señaló su lengua y luego abrió la boca. La niña finalmente comprendió. La familia de Jack eran asesinos en serie, y los padres del niño ya habían sido asesinados. Como ella no podía tener hijos, habían adoptado al niño como propio. Para asegurarse de que el niño no revelara el secreto, le habían cortado la lengua. Después, el niño tomó otra foto del estante, pasó a una página en blanco del álbum y colocó la foto de la familia de la niña, lo que dejaba claro que serían los próximos objetivos. Para convencer a sus padres, la niña inmediatamente tomó una foto con el teléfono y luego ideó la manera de pincharse ella misma para poder salir con su madre de la casa de Jack. Cuando la madre descubrió la verdad, quedó aterrorizada y buscó un pretexto para llamar a su esposo para contarle lo sucedido. Decidieron fingir que nada había pasado y buscar la manera de irse de allí lo antes posible. Sin embargo, no sabían que cuando Jack había recogido la pelota antes, había notado que la puerta secreta había sido abierta. Mientras la familia fingía calma al salir de la habitación, lo extraño fue que la pareja de Jack no los detuvo. Solo intercambiaron algunas palabras cordiales, aunque la sonrisa de Jack era algo inquietante. Cuando la familia salió, el hombre se dio cuenta de que uno de los neumáticos estaba desinflado, pero para salir rápido, tuvieron que ignorarlo y seguir como si nada. Justo cuando estaban por subirse al coche, Jack los detuvo. Dijo que el neumático estaba dañado y no podrían conducir, pero se ofreció a ayudar a repararlo. La pareja, para no delatarse, aceptó la ayuda de Jack, temiendo que de lo contrario podrían morir allí. Y para su sorpresa, Jack realmente reparó la rueda. Luego Jack se despidió abrazando al hombre y después abrazó a la madre de la niña. Pero al instante, de manera inesperada, comenzó a atacarlos. Para no enfadar a Jack y ser descubiertos, solo pudieron soportarlo en silencio. El niño también se despidió abrazando a la niña, quien le prometió que volvería por él. Luego los padres de la niña decidieron subirse al coche para irse. El hombre fingió estar tranquilo y pidió al niño que ayudara a abrir la puerta del patio, pero el niño fue llamado por Jack antes de poder hacerlo. Mientras la familia se sentía inquieta, Jack sacó un control remoto y abrió la puerta de la granja a distancia. Sin embargo, justo cuando creían que podrían irse seguros, la niña vio algo que la llenó de terror.
Imagínate ser una española viviendo en Argentina y que un argentino te diga: che, española, altas gomas tenés. Tú te quedas pensando, corte, ¿y este tío qué me acaba de decir? Les voy a contar la vez que un grupo de guachines me vieron la cara de boba. Actualmente ya llevo casi 5 años viviendo en Argentina, y esto me pasó cuando no tenía ni un año viviendo en Argentina. A los 15 años yo estaba con unos compas afuera de la secundaria a la que yo iba en ese entonces, y bueno, yo estaba ahí tranquila viendo como todos estaban jugando al truco, y de la nada, no sé por qué ni en qué contexto, uno tiró la de: che, española, altas gomas tenés. Y yo corté: yo pensaba que se refería a la goma de borrar, ¿viste? Y yo le digo: ¿Qué goma, tío? No tengo goma, le digo. Y me dice: sí, dale, mostrá la goma, española, mostrá la goma. Estaban todos cagándose de risa, pero yo no entendía una mierda. Tipo, yo no entendía, ¿qué me estás diciendo? ¿Qué goma? No tengo goma, le digo. No sé de qué goma me estás hablando, no tengo. Dale, mostrá. Y yo: ¿qué? Todos riéndose. Yo no entendía una mierda. Digo: ¿qué goma? ¿Pero qué me estás contando, tío? Y hubo uno que medio se cagaba de risa, pero se la aguantaba. Y me dijo: no, che, española, te están jodiendo. Y yo: sí, pero ¿en qué? O sea, ¿qué significa eso de altas gomas? Yo no tengo gomas altas, o sea, no entiendo. Cuando me quiso decir lo que significaba, todos diciéndole: no, amigo, no le digas. Y todos así: no le digas, no. Pero bueno, el pibe este no aguantaba verme la cara de boba, así que me dijo lo que significaba y yo me quedé, corté. No, la verdad es que me quedé en shock. Tipo, no sé. Se me borró la cara. No, me quedé dura. Los argentinos nunca se equivocaron al decir que Argentina es el país del descanso. Pero eso no fue descanso, eso fue falta de respeto, cara ladrillo.
The panel has reached its assessment. Dr. Vance's procedure is evaluated as exceptional. Flawless technique, optimal clip placement, zero complications, completion time well within the benchmark range. The consensus rating is outstanding. Dr. Gray's procedure is evaluated as presenting multiple critical errors, including clip failure, inadequate hemostasis, and a terminal vascular injury in the final phase. In a clinical synuclear, this performance would constitute a serious medical incident. The consensus rating is unacceptable.
This proves nothing. A simulation is not real surgery. This man has no license. He is a convicted. He was found to have operated under the influence. He defeated his own mentor. Whatever tricks he showed you today.
Dr. Gray, my name is Dr. Catherine Walsh. I am the Chief of Emergency Medicine at St. Martin's Medical Center. What I am about to present has been independently verified and submitted in full to the Federal Bureau of Investigation.
For the past 26 months, Dr. Nathan Gray has been conducting unauthorized clinical trials on surgical patients at St. Martin's Medical Center in partnership with Helix Pharmaceuticals. The experimental compound designated HX7741 was administered to patients without their knowledge or consent. 43 patients suffered adverse reactions. 7 are dead. Dr. Gray received over $300,000 in personal payments for his participation. The evidence is comprehensive, verified, and is at this moment being reviewed by federal investigators. And for the record, 5 years ago, Professor Harold Grant was already investigating these activities when he died on Dr. Gray's watch. The man who testified against Elias Vance had every reason to silence them both!
This is fabricated. She's working with him.
Dr. Nathan David Gray, I'm Special Agent Torres, FBI Healthcare Fraud Division. You are under arrest on charges of conspiracy to commit fraud, illegal human experimentation, and involuntary manslaughter.
Turn around, please.
Welcome back, Dr. Vance.
Helix Pharmaceuticals has been ordered to cease all operations pending a federal investigation.
Department Chief, full privileges, name your salary. We'd be honored to have you.
Thank you, but I have somewhere I need to be.
Come on in. Good morning, Mrs. Gable. How's that knee feeling today?